And COVID cases are on the rise across the country. 47 states and the District of Columbia are now reporting increases, with the CDC saying the Delta variant accounts for 58% of new cases. In Arkansas, hospitalizations are up nearly 64% in just 2 weeks, with doctors saying patients are sicker and younger than before and almost all unvaccinated. Alex Perez is in Little Rock, Arkansas, with the latest.
This morning, a new COVID crackdown, with 47 states reporting an increase in cases since last week. Chicago now reinstating restrictions for unvaccinated travelers from 2 of the states hit hardest by the Delta variant, recommending those from Missouri or Arkansas get a negative test or quarantine upon arrival. This as hospital admissions in Arkansas soar, up nearly 64% in just 2 weeks.
All of our ICUs and our medical beds, surgical beds are completely full.
Dr. Stepi Mehta says these patients are sicker than the previous surges, younger, and about 92% of them are unvaccinated.
It's frustrating, and there's a little bit of disbelief that are we really going through this again?
Vaccine hesitancy widespread in this state, even by some who were gravely ill. Cheryl Tucker, who's unvaccinated, just released from the hospital Tuesday after a week battling her second bout of COVID.
Will you get vaccinated now?
I'm not going to say 100%, but I'm thinking about it.
That hesitancy was what Tennessee's vaccine chief says she was trying to combat when she was fired. Dr. Michelle Fiscus believes she was terminated for working to educate the public about vaccines. In Tennessee, less than 45% of those who can get a shot are fully vaccinated.
Politics have been put ahead of the welfare of the people of Tennessee and the children of Tennessee. And those people are going to suffer. And this idea that people don't need to be vaccinated against the most significant infectious disease threat that we have faced in over 100 years, I think is a travesty.
So, Diane, doctors here really concerned about what's to come. Also, there are 6 medical organizations now across the country that are urging hospitals and healthcare facilities to mandate that their employees be vaccinated. Diane?
All right, Alex Perez in Little Rock, Arkansas. Thanks, Alex. And let's go to physician at Stanford Children's Health, Dr. Alok Patel, for more on this. Dr. Patel, thanks for being here. Cases are increasing in 47 states, and 58% of those cases are due to the Delta variant. Should vaccinated people be worried about breakthrough cases, or is this strictly a risk to the unvaccinated?
Diane, it's a good question, and thank you for having me. So I think everyone across the world should be worried about what we're seeing right now with the transmissibility and the outbreaks from the Delta variant. But as far as actually getting severely ill, hospitalized, or dying, that is by and large more of a risk for people who are unvaccinated. There's a very small amount of people who are getting breakthrough symptomatic infections if they're vaccinated. Now, breakthrough infections, asymptomatic, we expect some of those to happen, but getting vaccinated is a surefire way to protect yourself and your community against any variant. 99% of recent COVID deaths are in those who are unvaccinated. I wish I could just put that as a billboard in every single city in this country.
Now, in Tennessee, less than 45% of those who can get a shot are fully vaccinated. And the vaccine chief there, you heard her, she said she was fired for trying to educate the public about vaccines. What do you make of that?
What I make of that is a clear discrepancy between public health officials, evidence, what we know keeps people protected, and what's happening in these state and local level politics. Now, we all stand with Dr. Michelle Fiscus. She was doing the right thing in terms of advocating for children, for young people who may not be able to get vaccinated and are absolutely depending on the adults around them to do the right thing, Diane. And what's even more troubling is what we're hearing is that the Tennessee actually wants to block outreach for all vaccinations. So not just related to COVID-19, but other adolescent and childhood vaccines as well. It's very troubling.
Now, the FDA has warned of a potential rare neurological complication with the Johnson & Johnson vaccine. What do we know about that so far?
Well, the actual complication is called Guillain-Barré. So it is a disorder that actually targets your nervous cells. Your immune system can actually attack your own nervous cells. Now, it sounds very scary. It's actually rare, but we do see it. There's about 100 unconfirmed cases from the Johnson & Johnson vaccine. That's out of almost 13 million shots given. So, the FDA should look into this and look to see if there actually is a correlation. But, I worry that people are getting a distortion of perception of risk. People are worried about these side effects that are less than 1 in a million, not even confirmed. And they're not actually worried about what we know can happen from COVID-19 itself, from what can happen to you or your loved ones, or even if you get a mild infection and you could become a long hauler later. So people really need to understand that risk, benefit.
Now, one of the questions that often comes up when we see potential side effects from the vaccine is whether there's more risk of getting the vaccine or if those 100 people, for example, would have potentially gotten this illness regardless of whether or not of getting the vaccine. Do they know yet that this is definitely linked to the vaccine? And what is the risk-benefit analysis at this point?
So we don't know yet for sure if it's linked to the vaccine, but similar to what we've seen in the past with blood clots, for example, it is worth looking at. It is worth reviewing. And with myocarditis is a more recent and poignant example, just so the public knows that, hey, this is how seriously our safety checks are. And like you mentioned with risk benefit, you look at the risk. Let's say that we're looking at these very rare side effects. Right now, they're being estimated at about 1 in a million. If you look at the benefit, we said it at the top of the show, you and I did, is that 99% of recent COVID deaths are in those who are unvaccinated. We are right now, even myself, my colleagues, are seeing young people in the hospital, intubated, struggling for their lives because they weren't vaccinated themselves or the people around them weren't. And it is gut-wrenching that we still have to have this debate after we know what we need to do to keep ourselves and people around us safe.
All right, Dr. Alok Patel, always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.